Yeah, so I'm Dr. Eric Grasser. I work in New Mexico and I have a small boutique practice with about 500 patients. My purpose is to basically try to provide what I call meaningful medicine to a small group of patients in my local community. Yeah, I would say the most fulfilling part of the journey is just the opportunity to really get to know people and practice kind of what I call slow medicine in the way I think medicine was practiced in prior generations. And that's what my patients tell me, is that they appreciate really feeling like they have a relationship with their physician and that physician knows not only their medical history, but also more about them and their personal life and their family life and their community life. In that sense, I think it really allows me to practice more precise medicine and more, like I said, meaningful medicine to the patient, because I know them and the context in which they live. They're not just a number to me. Yeah, I use technology quite a lot, multiple different systems that have to kind of work together. Obviously, my electronic medical record is something I'm engaging with all the time. And then I also use a management system for my Concierge membership. I use a customer relations management system, which allows me to do emails, newsletters, outreach, and then I also do a lot of teaching for my patients, mostly now online. So I'll use a platform like Zoom and also use video conferencing for telehealth visits. Yeah, I would say for other practice owners is to remember that there is a demand from patients to see private practice physicians. I think that the consumer is becoming increasingly aware of the downsides to going to large corporate medical offices because of the fact that they are often just another patient without a specific personality, and that they're going to likely encounter a lot of turnover in personnel, whether it's their provider themselves or the ancillary staff. So whereas in private practice, I think people really feel like they're coming to a more home environment where they're seeing the same people all the time. And they also, I think, understand and appreciate that I have more autonomy, and that way I can customize their care, and that I'm not necessarily driven in the way I practice by administrators or bean counters or a lot of tight protocols and formalities. So it's a lot more like the old style medicine that people were used to growing up, where the family doctor was in their own office, and that's who they dealt with. And I think that they find it a lot more personal. So remembering that, and that's a lever you can pull for marketing and just for patient retention as well.